I do think there's a future and a solution out there where technology on top of data can save lives for patients and dramatically reduce costs. Whether we do that, whether other folks do that, I don't know. But there needs to be a whole new suite of solutions that are forward-looking and proactive and real-time, and we got to go and build that.
Thanks for tuning in to the Self-Funded with Spencer podcast. Let's go make healthcare better together. Here with Sasha, I'm going to say Milu, but it's Milu.
You say anything
and I want to say
want.
the French milieu, but I'm not going to do that. But Sasha, I appreciate you coming down. And this is crazy because this is the first back-to-back episode I've shot.
I love it. Doubleheader,
which is really cool because we didn't have to set up and break down the camera again. So Nathaniel's happy. But Sasha, I'm glad this worked out. I'm really excited you were down here for the HCAA conference, correct? And we were able to make this work out. And so if you don't mind, take a brief moment. What is today's episode kind of going to be about for the group that's tuning in?
For sure. Well, first of all, thank you for having me.
This is my pleasure.
Awesome. Yeah. I'm the founder of a company called Milu Health, co-founder, and we started Milu about 4 years ago now to do one really simple thing, which is use data and use real-time data to identify that there's something going on with a member, with a patient, with a dependent, and reach out to them as it's actually happening based on knowing what's in the health plan, what solutions are out there. But to build this early warning system that's never before existed in the employer healthcare space, but more broadly in our whole healthcare ecosystem. So that's what I want to chat about today.
I love it, man. And I got introduced to you, I think a few years ago. I was trying to track back in timeline when it was relatively early stages at that point. And then we lost touch for whatever reason. Then I saw you on stage at one of our Pareto events a few weeks ago as well. And I'm like, we've got to reconnect because obviously you piqued my interest and reminded me why we talked in the first place. And I thought it was great to focus on an episode here. So let's backtrack in time for you though, because we're in present day with the business you've built. But this isn't your first foray into healthcare and healthcare tech. So give us a little of your bio, if you don't mind.
Sure. So I've spent my career in startups and technology, most recently in healthcare startups and technology. And I've always wanted to build something that impacts our healthcare system. I think I was like a 22-year-old out of college and thinking about like, hey, what's a startup to go start? I had this dream of like, can someone build a new EHR? Like every good health tech entrepreneur does. Like, hey, can we do something different? And I learned pretty fast that like there's a reason that Epic is the system that everyone loves and uses. Took them about 40 years and it's incredible for a health system. So I didn't go and do that. But I've always had this dream of like, can we use the latest and greatest in technology to build something that A, doesn't exist today, and B, can either reduce costs or improve quality. So throughout my career, I've done a bunch of technology stuff. Most recently, before Milu, both me and my co-founder Gotham helped to build this company called Tempus. It's based in Chicago. It's an AI and healthcare company that does genomic sequencing for cancer patients and for other kinds of patients. And so Gotham and I met there, and we built all kinds of different systems that use AI to develop new algorithms to treat some of the sickest patients in this country and frankly in the world. And what we kind of realized was there's so much more data in the healthcare world than there ever has been. Like when you look at graphs of like the amount of data being generated in the world, the amount of data that can like feed AI systems, healthcare is a massive, massive, massive chunk of it because it's used for billing, right? Like everything has to be documented so that a bill can be submitted, and maybe it's reviewed, maybe it's not reviewed, et cetera. So we became obsessed with this concept of, because there's so much more data, is there something we're not doing with it today that we could to ultimately reduce costs and help get people to the right care at the right time? So we started.
Well, give me an idea of the volume of data, because to me it seems like an overwhelming amount of information that it's impossible to parse.
Yeah.
And then you're saying it just ever increasing in sort of speed and volume of
every single day,
every single day, right?
I mean, to give you a sense, like for the numbers are in like beyond terabytes. It's like whatever is like not the one after a terabyte, not the one after the one that's after a terabyte. Like it might
as well be infinity.
It's crazy.
At this point.
The only thing growing faster is healthcare costs, right? But we got to do something about that. The data growing is a really good thing. But the problem is the data exists in all these different silos. You have your lab testing data here, and if you get a genetic test, it exists there. And if your health record is at this system and that system and that system, and your claims data is here, and it's really hard to get your claims data, all that stuff, right? Yeah. But when you can put those things together, you see magic. Like there's already, I see this, I think, on Twitter, like every few days, there's a patient who says, hey, I had this crazy thing. Nobody could solve it. I have great doctors. Like everybody was looking at a piece of the puzzle. I asked ChatGPT a question or two, and like it came up with a new diagnosis for me. And like I'm sure for every one of those, there's like 15 where it says like completely asinine stuff that like isn't.
No, but to your point, I use X or Twitter quite a bit. That's where mostly my news source, because it's really quick. I can pop in and pop out. But I do see those very regularly where it's like I've been struggling with Crohn's disease or IBS or some idiopathic disease state that was causing me issues for years and years and years, and went to so many doctors and nobody could tell me what it was. Then I plug in my information, upload a couple documents from my health records, and boom, it says maybe you have this, or it looks like you have this. They go back to their doctor confirms, they start getting treated for that thing, and symptoms resolve in a couple weeks. I mean, it does feel like magic. And it's like that's the absolute top use case in the current moment for me for healthcare and AI is helping troubleshoot some of these really weird disease states that doctors have not been able to solve.
Exactly. And like, everyone loves to ask these questions like, oh my God, is AI going to replace doctors? And like, it's not, no way. Like we're going to have more doctors. We're going to have better doctors. Like all the studies coming out now, AI doesn't beat a doctor. Maybe in some studies, like it's starting to show that it can do something, but at the end of the day, you're not going to go to an AI instead of a doctor. You're going to do both. But a doctor who is AI enabled, or a patient who's AI enabled, who sees a thing and then goes to their doctor and says, hey doc, I was thinking about this thing. Like, what do you think? It's the future.
Yeah, because it replaces where Dr. Google used to be the, probably upsetting to physicians because Dr. Google gives all sorts of random answers to now we might have
that stuff's so bad.
Dr. Grok or Dr. ChatGPT or whatever it may be, when in reality, they're probably a lot more accurate and precise in some of the symptoms diagnosis. And that would be valuable for a doctor to get all that history, to know that you've actually done your own job to help kind of triage and identify what you've got. Worst case scenario is a doctor looks at the information and says, you know what, I actually don't think that's true.
Right.
Okay. That's no big deal. But if it was confirmed, you just help probably speed up the process to get to a resolution of some sort.
100%.
Which I think is beneficial. I'm of the mindset, you do hear some doom and gloom stuff about AI. You do think maybe we'll go the route of robots taking over and deciding they don't want humans, or we all just get empowered and boosted by AI, and it helps create new jobs and all those things. I don't know which path is the right one.
I'm betting on that one. Yeah, okay. I'm a big optimist with it. Like, it's not gonna take over. Like we're okay.
I'm gonna take your word for it. I'm gonna trust you.
But big but we got to be really careful with this stuff, right?
Agree.
Like we have to build human in the loop systems, which means it's a thing that we do. We run a ton of AI safely and securely on top of data. It doesn't flow off to God knows where, what AI model and train for what it's in a HIPAA compliant environment through Microsoft. And then when it spits out answers, we don't shoot them off to patients. We give them in our platform securely to our clinicians, nurses, and pharmacists who review it and say, great, garbage, great, garbage.
Yeah.
And then you have a human making a decision based on stuff that AI is identifying. We're seeing it today. It basically, by introducing AI, we catch twice as much stuff. Like literally overnight, 2x.
Yeah.
Because, the AI agent is able to see, hey, this patient actually had something 2 years ago that relates to this thing. And so they actually, might need a referral. Or, the doctor mentioned a referral, but it didn't officially get documented in the thing. It wasn't a separate bullet point, but like they mentioned that you should see an orthopedic surgeon. So like that's going to happen, but a human being can't catch that.
Chronic health issues, surprise out-of-network medical bills, inflated medical and prescription drug prices. These issues cost self-insured employers hundreds of millions of dollars every year. Add to this the rising cost of care and potential for waste across the life of a claim, and it's clear that self-insured employers need innovative solutions that lower their health plan spend. At Valence, we've done just that, developed innovation that shifts the current paradigm. A complete and integrated ecosystem solution driven by data, one that manages and simplifies the complexity of medical claim costs. It is through analyzing millions of data points that we enable employers to realize and fuel cost-saving solutions. Valence experts come prepared from day one, targeting the fraction of claims that will drive the majority of health plan costs. That is how our team lives the Valence promise, engaging early and often for smarter, better, faster healthcare.
Well, so what was missing in the healthcare system today that caused you to build this business?
The thing, by the way, it's still missing.
Okay.
You know,
Okay.
like we're doing great. We're growing. We're having a lot of impact. We account for this much of the healthcare system. The thing that's missing is when something happens to you as a patient, there's nothing to proactively reach out and help guide you, help you find a great doctor to go to, help you use the solution that's in your health plan that you didn't know about that's going to be free, help you schedule an appointment, help you reach out to your TPA. Like you're on your own, and then you're dealing with, oh my God, I got this bill and I got this number and that number and this claim code, and you're stuck in the middle of it. And ideally, you're a patient who has an amazing physician who's got the time for you, or has a very specific condition that like a specific physician can treat, and you're good, right? Like X% of people get through the healthcare system and they're okay. 2X% of people get stuck when something is bad, and there's no early warning system and there's no proactive outreach system. And the only way you can do that is with data and AI. So that's the thing we're trying to solve. Like my dream is that every patient in this country who wants it, right, to use Milu, you have to sign up, you have to consent, you have to want our provider services. But for every patient who wants it, you should have a system that can review your information and tell you, hey, you have this medication that just got prescribed. It actually conflicts with this other thing that you're taking. Or, hey, you've got this care gap. Like you should really schedule that MRI that got ordered 8 months ago that you didn't get taken care of. And like today we rely on maybe you get a reminder phone call every once in a while and it just doesn't happen.
Yeah, or you don't get any reminder phone calls at all, and you just go, "Oh crap, I forgot to schedule this," and it's been too long at that point. I mean,
exactly.
Now I'm thinking I got to reschedule a dental appointment that I was out of town for that I missed.
100%.
Just a routine cleaning, but still, oh crap, I forgot to redo that. Where is the data set coming from, though? Because you guys are obviously normalizing and identifying these patterns within it, but where are you actually getting the information from?
Yep. So the data set, we get data from a lot of different places. The magical data is in health records. It's in real time. It's out there. It's at healthcare systems throughout the country, and it's aggregated and put together. And as a provider organization, we're actually able to go and access it with when a patient signs up for Milu. And so that is so impactful because it's doctor's notes, nursing notes, pathology reports, radiology reports, lab values, like the same things that you see when you log into your MyChart, they're available and they can be used to help you. We'll also go pull in claims data for a group if they have access to their claims. Our team communicates with patients, so we use that information. But the health record is this really special and amazing thing that can help people in a huge way.
Well, and you said you're able to get access to it because you are a provider, right?
Yeah.
So how do you get into the classification of being a provider so you can access that information?
So this is actually huge. We have a team of pharmacists and we have a team of nurses. Our pharmacists perform medication review and reconciliation services for every single patient. And it's kind of crazy. Like this is like reviewing meds, making sure that folks are on the things that they should be on, that their meds don't conflict. This happens today in Medicare and maybe Medicaid, but I think really just Medicare because there's incentives and payments associated with it. It doesn't really happen anywhere else outside of someone getting discharged from a hospital. Okay. The reality is like that should happen all the time for any new medication that could have a potential conflict. So that's number one. Number two is we also have a team of nurses that review for care gaps. And see, really, really crazy stuff. By the way, it's usually not doctor error. Like it's almost never doctor error, despite the crazy stories we may see out there. It's this thing hasn't happened. It's this is a diagnosis that was maybe not acted on, and so there's a ton of things there.
And so those nurses, are they doing any kind of care coordination or care navigation on top of it once you identify those gaps?
Yeah, so it depends on who we're working with and how. We work with, some groups and plans and TPAs where they already have navigation. And so they want us to go and perform our core services and identify this stuff and then go route it to the right place. Like, the patients don't need another app. They don't need a fourth phone number to call and to be confused and 8 different brand names. So we're kind of agnostic. When we have groups that don't have that in place, we're happy to pick up the baton and we go and do it, and we provide those services. And we help people schedule appointments and get and use the right point solution and just get stuff handled and figure out what to do about a bill, et cetera. And then when we have groups that do have solutions for that, that's great. Those solutions are typically really good at what they do. Just no one knows about them.
Yep.
And so we go and we route folks to that.
Yeah, and I imagine just even a second set of eyes or almost a second opinion to help identify those care gaps. Or do your nurses actually get with the external care navigation team and discuss pattern or pathways for treatment? Okay.
100%.
Okay.
It depends on the group and what they need. It can be we identify a thing and we tell the patient about it and hand it off. It could be, hey, we're deeply getting engaged because this is a really critical thing that's happening and everyone's got to get around the table and solve it.
Gotcha.
So we do both.
Well, so who, I guess the question would be is, who's ultimately your partner or your customer? Because, we're discussing you were at HCAA, which is the Healthcare Administrators Association, right? So TPAs. Then I could think of a consultant. I could think of an employer. There's probably other partners as well, but do you have an ideal customer in your mind?
It's funny. We don't have an ideal customer. We work with a lot of brokers. We don't work with a ton of employers directly outside of a broker advisor because honestly, we kind of learned this the hard way. We're pretty deep in the healthcare system, right? Like we're talking about health data and health records. It's a little far removed for a direct conversation with an HR team without an advisor who's bringing us to the table. So usually we're working through a broker, a consultant, or advisor. And we also work with TPAs. We work with other folks in the industry, stop loss carriers, et cetera.
Yeah. Yeah. The TPA, I could see the application for the TPA and especially stop loss, which I want to discuss next. But when you are working with a TPA and they say, Milu, we want you to help us do X, Y, Z, like what are you doing to add value to the equation for the services that they're already providing?
It's funny. We're very upfront about this stuff. Like we're not a point solution. We're not going to provide better deep diabetes management for your diabetes patients than your diabetes solution, or we're not a center of excellence, right? We're not going to go and get your patient who needs heart surgery to the Cleveland Clinic. What we can do that doesn't happen today is see this stuff way in advance of it happening and go get folks to the right place. And so for a TPA, it's, look, you can go down the route that everyone's going down today, which is we're going to provide great service because it's needed in our system, and we're going to have this suite of solutions, and that's what we do. Or you could take the next step and say, and by the way, we can proactively identify the stuff that's happening now in your population that no one's doing anything about. And we can take our existing case management team and go and have them intervene 9 months before it's an emergency room visit. And you can only do that when you have the data and the AI system. So that's where we really can help.
Well, yeah, because I'm thinking about, and I just had this discussion with Garrett Giroux before, who's a consultant with the Insurance Center, which is now Alera. And I was talking about TPAs sometimes get lost in the shuffle because there's tons of TPAs out there. They're low margin businesses. You only really hear about them when they, having a bad cycle, if you will, and they all go through a bad cycle every few years for various reasons. And I think about what differentiates a TPA these days, because processing claims is brass tacks, right. It's table stakes. What are you actually doing to add real value to the plan in terms of outcomes or quality of experience and navigation? So I could absolutely see the application for a TPA to want to use this as a way to differentiate themselves. Can you give me, in your mind, an ideal use case, or what is the one like you're already seeing emerge today, even in the relatively early stages, where you're going, we're really good at identifying X and preventing it? Yeah.
The no-brainer use case is I'm an advisor or a TPA, and I have my groups where I've spent, half a decade building plans that are really good Like the right incentives are in place, the right networks are in place, the right contracts, the right solutions. Like if I identify that there's someone with a crazy thing, here's where they're going. If I identify a future knee surgery, here's what's happening. If I need people to go to a great doctor, here's my solution. Like those things are there. And then you say, well, the problem is like 3% of people actually use it when I look at the real utilization number. So I've got all these things, and aside from like turning my incentives into crazy sticks, I'm not able to dramatically get my people to go use it more. And like, there's no more that I can say during open enrollment meetings to get interviews. And that's where like we absolutely shine, because it's very easy. You sign up for Milu one time, and we become this system that can sit and track and connect you with a provider to help you with key stuff, and then get you on all the right solutions as you actually need them.
Yeah. So the member too, did they understand what Milu does? I mean, like, how do you help explain? Because I'm sure folks like myself might be skeptical sometimes of access to data and Big Brother and all those things. So how do you help them overcome their concerns around that? Like, what's the positioning to a member?
It's very straightforward. When you sign up for Milu, you get access to a team of nurses and pharmacists that can be there to A, identify stuff for you as it's actually happening, and then B, help guide you and route you. And by the way, it's all over text message with us.
Yeah.
Like there's no app, you don't have to go and call, like you can just text. And for us to do that really, really well, we ask one thing, which is that you authorize us to connect to your health records so that we can actually see stuff ahead of time. You don't have to do it. It's totally fine. There's people out there who say, my data don't want anyone touching it, dealing with it. No problem. Totally get that. By the way, your claims data is here and this other data is there,
it's
but
already
like
out there.
It's a personal decision, and that's great. We see crazy high rates of people saying yes when we explain like who we are, what we do, what we need. Like 90+% of people are like, sure, if you can help me. And by the way, help me is get me great care, catch bad things that are happening, connect me to this benefit, or save me money. Yeah. Right? Like if you can do those things for me and my family, like great, let's do it.
Yeah, no, I mean, I totally understand that. I think we're on the cusp of this world where maybe we've already crossed over the threshold where privacy as we used to know it, does it really even exist anymore? I mean, we're all accustomed to sharing things publicly on social media, but then our data is everywhere. It's phones are tracking us, all those things. And so do we have a reasonable expectation of privacy, but then when you really peel back the onion, I'm not sure it actually exists all that much anymore.
I mean, I've seen
this is more of a philosophical conversation than it is about Milu, but I would like to hear your opinion about that.
From a Milu perspective, we don't take that approach, right? We take the approach of like, this is the most important thing in the world, and our business depends on never, ever, ever losing your trust or messing it up. So it is locked down. From a me personally in the world perspective, like people have shown if I go outside my front door and I take a picture without my address in it, I put it into ChatGPT, like
it can locate you, right?
It can locate you.
Yeah.
Now, they might have shut that down a little bit. I tried it recently at a buddy's house and it didn't.
It did work? It did not work. Okay, good.
But like, it's out there, right? And I don't know, how many notices have I gotten from literally every hospital I've ever gone to? I've gotten a notice in the past few years that, data breach, everything we have about you has been taken by hackers who live in, I don't know, Bulgaria or North Korea or something. Like, it's there. What that means is for us as Milu, we are like extra careful and cautious.
Of course.
But there's a lot of data that exists in the world today.
Yeah, no, I mean, I'm just kind of going through it. The thought process is read in real time, thinking about it, because you want privacy. I think Americans have always valued privacy and being able to have your information protected, and we have all sorts of guardrails to ensure that's the case. But the reality is it's escaped for the most part. And unless you're going to live completely off the grid with no phone, no technology, et cetera, very unlikely that you're going to get true privacy in the world today. And I don't necessarily know that it's all that bad. You see with Generation Z, which I know, and you're a Zoomer, right? Yeah. Yeah, so Zoomers grew up in a world where everything was online already. I mean, they phones are in their hand, iPads. My kids have access to iPads.
Yeah.
And so like they're just accustomed to those things being available and the sharing of information all the time. You and I existed in a world that was previous to that, right?
Yeah, dial-up internet, Napster.
No internet and all that stuff, right? So just kind of thinking about it real time.
Pareto Health is the largest benefits captive in the United States. With nearly 3,000 captive members, 1.3 billion of stop-loss premium in force, and almost 1 million covered lives, no other benefits captive comes close to Pareto Health's scale. But it's not just about the numbers. Pareto Health is a mission-driven organization, and that mission has two distinct parts. Number one, to make self-insurance simple and more accessible for small to mid-sized employers. And number two, to arm them with the most powerful cost management tools on the market. So if you're an employer frustrated with your healthcare outcomes, or you're a benefits consultant looking for an alternative to the status quo, it's time to consider Pareto Health. Pareto Health, where employers come to do self-insurance right, to do it easily, and to do it at scale.
But back on track. I can also see the use case for stop-loss carriers, and I would love your opinion. I've already got my opinion of how it could be used, but I'd like to hear how stop-loss carriers are perceiving this information and what value they get from it.
Yeah, it's funny. When we first started Milu, like we got advice from a few folks, like, hey, make sure you talk to stop-loss. Like, there's really something there. We don't know what it is, but like, go have those conversations. So we had a few of those conversations early on, and the perspective was, listen, I as a stop-loss carrier am kind of further removed from the member and the patient, and like what I can do is a little bit limited. I get a claim, I pay it if it's on the policy, I don't pay it if it's not on the policy. And you know,
but by the time it hits their desk, they're at the end of the line. It's effectively already happened, and their obligation is to reimburse.
Exactly.
Right,
what are you going to do? It's either in the contract or it's not in the contract. That's all you can do. Now, and I think this is mostly on us. Like, we've made the platform a lot better. Like, the AI has come to life. Like, you can see the data. When we show the platform, like I pull up my own record, which I'm happy to share because I want people to see how it works. But like, I can ask, what are this patient's most recent lab values? Like, are they likely to get a surgery? Do they have anything scheduled? Do they have a derm visit coming up? Did they have a derm visit recently? Like, what's going on with them? And does this patient have any care gaps? And then that just opens people's eyes to like, wow, you can really do a lot here. And so for a stop loss carrier, they can identify, do I have someone with late stage cancer or early stage cancer? Again, if a member consents and signs up.
And are you seeing that on the front end? So, because I'm thinking about a situation, and you may or may not know, but if a group is fully insured today, right, looking at bringing themselves under, whether it's through a captive or externally, and a stop-loss carrier is quoting.
Yep.
Milu may not have entered the equation yet, right? So how do we get you out in front of to assist that stop-loss carrier in the initial pricing versus renewal pricing instead?
We don't do that today.
Okay.
I've heard that, like, oh my God, that is the holy grail.
It would be, yeah.
For us to do this, we provide treatment services to patients, so we can't like engage early on before a group is actually live. Like, the group has to actually be live. We have to be working with patients to be able to
do fair enough, right? And I mean, I'm thinking in technologies like a Gradient or a Verikai, which are looking for whether it's social determinants of health or just predictive analytics around the data set that they have to help with carrier pricing, to help them get around this idea of, hey, we can use AI to at least augment our underwriters' expertise on how to price things. But if you miss sometimes in the world of stop loss, you miss really big. And then the cases that you think are going to be hairy dogs end up being the best cases you have because a couple things go away. And it's very difficult to predict on an individual case-by-case basis which one of those is going to be.
Right.
You can do it at scale pretty well if you're disciplined, but individual cases are very hard to price.
Right. And in our world, we can help with that because you can get a real understanding. Now, you don't know if it's going to go away, right? If somebody's going to change jobs, there's no way to predict that, or retire or whatever. But you can understand like what's going on with someone beyond the case notes that they get today, which might be 3 sentences from one phone call from 8 months ago, and the patient didn't want to have the conversation because they're busy getting treated for something. And then the other piece is we can actually help on claims as they're happening. right? Like by the time the stop loss carrier sees it, the thing has happened. The hospitalization has ended or is ongoing, and it's massive. We see stuff 9 months before it happens. Not a car accident, but a chronic condition that's worsening. We ran a study recently. It was for a big partner that we were talking to, and they came to us and they said, listen, it's really cute that you guys think you can predict all this stuff. We have all the data in the world. We've spent years building predictive models. So what we want to know is, like, of all the surgeries out there in claims, because those are all the surgeries that have happened, how many do you see early on? And then when you see them, it's not so useful if you see it 3 days before the surgery happens. If you see the pre-surgery visit, done. Too late. It's not better than the prior auth. So we ran that study. And they wanted hey, can you catch 30% of surgeries when you see them? Can you catch them 2 weeks in advance? What we saw was we catch 80% of surgeries.
Really?
And we see indications of them months in advance, an average of 90 days.
What would be an example of something that would be indicative of a future surgery?
Think about any orthopedic surgery. Okay. Outside of accidents, those things don't happen out of the blue, right? You have knee pain, you have shoulder pain, you have hip pain, and you talk to your PCP about it 1 year, and then it's a thing. It's there.
Maybe got an NSAID or something for it.
Exactly. And then next year it's gotten a little bit worse. Next year, okay, I think I need a referral. Maybe I need to get some shots. And so we see that from the first conversation, right? That this is a thing that's starting or that's escalating. We see it oftentimes before the specialist referral. And certainly we see it on the specialist referral and those conversations, which is, almost no one's getting surgery at that first visit, right? It's an initial conversation. Ideally, it's, a clinician.
So their expectations were you might catch 30 and you guys caught upwards of 80% of that.
Yeah.
Okay. Why do you think you were so successful, whereas other systems might have failed in doing that? Other than you're at the helm and you're
honestly nobody's doing this way today, and they should be. There should be 1 million people doing this, and they're not. But the data is really powerful, and the AI is at a place where it wasn't 6 months ago and it wasn't 2 years ago. And so we can see that in a health record and a combination of a health record and claims data, you've got someone who's talking about knee pain and knee pain getting worse. And you don't have to be the best AI developers out there to build a system that can catch that well.
Well, yeah, I'm sure you're being somewhat modest because it's not like anybody could do this. And you're probably under suggesting how difficult it is to do, right? Which is, to be fair, I get it. But, I would love, obviously, for this type of technology to proliferate if it is as accurate as it is, as you're describing, as, catching surgeries or finding patterns in data that prevents something from happening in the future. I would love for that to be just common. And it sounds like from what you're describing, we're just on the bleeding edge of it at the moment.
Exactly. And
yeah, go ahead.
Yes, I was being a little facetious. To build the technology to do this stuff, it's taken us 4 years of heads down build, and we've failed. Every day there's a different failure of we just stood up this algorithm to try to catch this type of procedure, and it's catching way too many things that aren't right. Literally our nurses and our pharmacists look at that stuff every day and say, hey, here's how much AI helped me, and here's how much AI brought me down because it caught all this junk. And that's the real thing that I think over the long term is going to be impactful. It's having systems that have been trained on successful interventions in the real world.
Yep.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
And so that actually leads me to segue into my next kind of question is how fast is it evolving, right? Because it's iterative, right? You mentioned could be a couple months, 6 months, there's a new version. It's better, faster, stronger, whatever. Like, how do you keep up with a business that's so reliant on artificial intelligence as the basis for it to stay in front of the evolution of the tech as well?
What's cool is the things that are cost prohibitive today, because it's crazy. I just saw Elon's building an insane data center. OpenAI is building a thing that's, I don't know how many football field, just like pictures of cables. And it's a lot of processing that goes into this stuff. And so we come across this all the time, that like a query that for us in the past was cost prohibitive, right? You can't run $100 of AI compute to recommend a better option for a $50 lab test, right? Plus the intervention, plus the conversation with the patient, doesn't make sense. 6 months later, like that cost is dramatically lower because there's better technology and because the new model has come out, et cetera. That is really cool because you can process so much more data now and you can do things that you couldn't do just a little bit ago. So for us, it's how do we build a system and a platform that has the right relationships with patients, that has the right relationships with groups, plans, employers, et cetera, and that has the right data pipelines that then when there is a better algorithm or a better model, we can slot it in and test it and make sure that it's performing, but nothing else changes, right? You don't have to reinstall a system.
Well, yeah, because the end user, nothing looks different.
Exactly.
Correct? Right, okay. I was going to ask you then about the energy production, right? Because you mentioned these giant data centers, and I've been hearing obviously the noise around like how much energy is required to run some of these data centers, and whether or not we can even produce adequate levels of energy to keep up with AI. So, like, do you have thoughts around how we scale the infrastructure up in order to do that?
I have no idea. Okay. None whatsoever, because I spend my life thinking about like, what is this one part of a health record that's not showing up the right way? And it should, but I mean,
are these reasonable concerns as a constraint though, I think?
Yeah, and we got to solve it as a country. Like the amount of energy that China is producing compared to us is insane. Mm-hmm. Like electricity generation, nuclear power for electricity generation, solar power, like we gotta catch up. We gotta do that.
I think we need a world, and this is just me having fun, but I think we need a world where we have our own mini nuclear reactors that power our house and power our computers.
Did you see? Literally, I was talking to a buddy about this. There's a company doing that, not for houses, but like for industrial projects. Yeah. So like, some factory will say, "Hey, we need our own power source," and these guys are trying to create modular, small, safe nuclear reactors. They could go like stand up next to your building in 6 months, all reusable components, nothing new. Off you go.
Sweet.
And like,
sign me up, man.
That's a game changer.
Yeah,
right?
Then we'll have nuclear powered phones and we're off to the races here. But, do wearables play a role? The data that comes from wearables play a role for you guys?
Not today.
Okay.
It will. It absolutely will. Because more of us have them. More of us are using it. And the data's good. Like, I'm not a super wearable guy, but
I haven't been one myself. I understand the value. I guess I haven't gotten over the hump of like, I have my intuition. I sort of have my patterns of the way I eat and diet and sleep. I know what it's going to tell me. Yeah. And maybe just having it tell me would be useful to change some behaviors. But I've worn CGMs before. Useful data that really just reinforced I knew when I eat that, blood sugar spikes. If I don't eat that, blood sugar doesn't. So like I haven't got to the point where I think constant longitudinal data collection on myself is necessary. Yeah. I'm sure I'm going to get there at some point though.
Yeah. It's funny. I follow the people on Twitter or X who measure themselves and learn some stuff and then write about it. So yeah, I'm not measuring them myself, but like, I'm reading the dude that, had a few drinks and went to sleep and it did whatever it does. And like, oh my God, you got to know that. And I still want to live my life and do what I want to do. But now we know a lot more, right? Like we know more about the effects of alcohol. We know more about the, impact of plastics in our stuff. So
I could see it sort of infusing into the EHR just to give you more real time what's going on with a person right now in this moment. If there's some triggers or red flags that pop up, I'm trying to think about where healthcare is going. And I do believe the wearable data collection will be very useful. Again, though, thinking about privacy and how we protect people's privacy. But if your doctor has access to your wearable and your wearable shows a heart rate spike or your elevated base heart rate, or you have blood pressure, signals that are coming, could they get in front of an imminent heart attack or a stroke or something like that? I don't think that's unreasonable to think that's going to happen.
It's not. And by the way, there's companies, not us, but companies out there in like the provider space that are building incredible AI algorithms that sit on top of data that exists today and catch crazy stuff. Like look at a reading of an ECG or an EKG. You go in and it's and it comes back and you're fine. It says you're fine right now. There's now AI algorithms that are FDA approved that say, yeah, it said you're fine right now, but you're at 10x increased risk of this thing in the next year. And like your your doctor needs to know that, and you got to see a cardiologist. But the said you were fine. Like that's all coming, Well,
I was joking earlier, and I don't know if we were rolling yet, but the Minority Report, I can imagine we're at a point where it's like you're going to have this stroke in 7 years if you don't change, right? And get to the point where I don't know if we could eradicate diseases per se, but we could certainly get well out in front of some preventable disease progression.
100%. It's happening. I don't know if you've had any of the like early cancer detection companies on here before.
What's the one? We haven't had them on. Grail. Yeah, that's the one I was thinking of. We haven't had them on yet, but I was talking to him not too long ago about it.
Like that stuff's very cool. And there's new ones coming out and being tested. I fully believe that we'll be in a world where you get your blood work done in your annual physical. It's also checking, are there cancer cells in your blood today? Today those tests aren't great at catching early disease. They're way better at catching late stage disease, which is less helpful. But they'll get better. They'll get way better at catching a stage 1 esophageal cancer. And we need that. We desperately need that. And then I think, going back to your question on wearables, our system is starting to evolve around that, right? Like more doctors are pulling in that data, looking at that data. There's now some billing codes that can reimburse a doctor for looking at it. So I think it's all going to go there. There's this company. It was during COVID, and they built a machine that you could have in your house, and you swab yourself for COVID or the flu or the common cold, and you stick it in this thing, and it spits out an answer. But it was like a whole machine, because it's not just like a one COVID test. It does all that stuff. And I think they raised a stupid amount of money and they went bankrupt. But I think it was a glimpse into the future. I think someday you and I are going to wake up and we're going to say, okay, I don't feel great. I'm going to do this swab. I'm going to take this reading. I'm going to put it into this thing. This thing will be connected to my health record. It'll know that I had this a year ago and this 2 years ago, and it'll, give me some guidance and let me press a button to talk to a doctor, on my app.
Well,
that'll happen.
It's not that, again, it's not unreasonable to think. I've seen a couple different organizations that have your cell phone can read your face essentially and look, I think it's looking for flushing of the skin and your retina. And there's 5 or 6 different metrics that can be uncovered from just a face scan that takes about 30 seconds. Blood pressure, heart rate, things like that, where there's no pricking of a finger, there's no blood draws at all. I mean, could you imagine a world where that's in your shower in the morning, where you do a 30-second scan while you're in your morning shower? Boom, it tells you your health status in that very moment.
100%.
And all this, though, to kind of get us back, because I want to really focus on Milu, is how can we use tech to improve outcomes and lower costs? If you look at some of these charts where it shows the rising cost of hospital services versus the lowering cost of cell phones and TVs over time, obviously they've bifurcated completely.
Yeah.
Technology could help us bring down the hospital and healthcare costs.
100%. 100%. it's all well and good for us to sit and dream about the future machines and like it's a few decades away. I'm sure they got to be FDA approved, all that stuff. But like today, we've got an employer who runs a manufacturing facility in, I don't know, in Minnesota, and they're seeing their costs go up 30% year on year, and they're hit with a catastrophic claim, and like suddenly the business is in danger because of healthcare costs. And like, what can we do about that? So our perspective is we can now start to see stuff before it happens and go and reach out and do something. Like, we're no longer in this world of, okay, I bought my plan from my big branded carrier, and like I get my dollar amount and I'm self-funded. So, I authorize payment, or I'm fully insured. And so, I see my increase. And like beyond that, the carrier's got some programs and there's nothing else I can do. And I think the world now is you can get your data, you can get your claims data. Like there's plenty of groups that can go and analyze and do stuff about it. B, you can go and bring in smart solutions and say, we've got a musculoskeletal problem, or we have a cancer problem. Let's bring in this solution to help our people and to try to help manage costs in those areas. And now there's a next piece of that, which is, and I can now in real time see the things that are happening for my employees and help them. And I can go and route them to the highest quality doctors, and I can route them to my direct contracted, specialists and surgery centers. And I can do it because the information's there and AI can help us.
Yeah. Well, and I asked earlier, what was missing in the equation that caused you to start Milu, but now as you built it 4 years on, are there still pieces where if we just had access to X, or if we were just able to bring in Y, that would supercharge our business? Where are we on the cusp with Milu at the moment?
Everywhere. Everything needs to be better and faster, like all the time. There's a few things. One is like the data's not perfect. Health records are messy. Like we see health records are copy pasted, right? Like the same things in there 50 different times. And so, we have to get better at our technology of like identifying what's real and what's new and what's important. Our broader healthcare system has to get better at like healthcare records flowing and the data being interoperable. Our patient communication has to get better, right? Like we realized really early on when we first started, we'd reach out to you and we'd say, Milu alert with a cute emoji, and like you as Spencer sitting here would be like, okay, swipe, like I don't care, this is garbage. And then accidentally, like one of our nurses, when she was reaching out, she would just be a human. She would say like, hi, I'm Brooke. I'm a registered nurse. I saw this thing. Let me know if you need some help. And like, oh my God, we just had a day where like everybody responded.
Yeah.
And so that opened our eyes to, okay, great. Technology is not actually the solution on that part of it. It's a human, a nurse, a pharmacist reaches out to someone and helps someone. So it's those kind of like daily learnings that I think are going to keep making us better. Yeah,
and we mentioned earlier it's fully insured group or self-funded group. Is there a requirement for Milu to really work well that they already self-funded, or can a fully insured group?
No, fully insured groups. Okay. We work with them today. They can work with us like no problem whatsoever. The caveat is like they have to want what we're doing, right? If they're a fully insured group who's planning on staying fully insured and they're happy to take, an annual cost increase and they don't see the cost and they don't care about the cost, like they're probably not going to use us.
Well, they wouldn't get the most out of what you offer, right?
Exactly.
Yeah, because I think about it, like even if you gave individual members this information about themselves and help them, uncover a situation or prevent a situation, you can't really guide them. You can't really steer them in a fully insured environment. And they're very likely getting the cost increases regardless of the individual claims outcomes. That's just the environment they're in.
Exactly.
So I usually say like self-funding is the start, right? You have to be self-funded to do almost everything I discuss on this podcast. Doesn't mean it's the solution. It just opens the door for all these possibilities. And I think your business is not too dissimilar to that.
Right. Yeah. And we don't see that as a barrier because more and more of our country is waking up to that and being self-funded, and smaller groups are, and they're trying to, take action and take control of their healthcare costs and actively do something about it.
Yeah, you guys, I know you obviously were on the stage with us a couple months ago, but like, are you seeing captives wake up to the possibility of what Milu's offers as well? I imagine the answer is yes. Yeah.
Yeah, absolutely. I mean, whether a group is in a captive or they're going out and getting their own stop loss, like the answer is the same. Like, they realize that costs are a problem, and if you can do something to get ahead of an event, it can be a complete game changer. So yeah,
I'm thinking too, if I'm a consultant, because a lot of my audience is consultants or people are in that space, right? I'm going, this sounds interesting. Maybe I have a group in mind right now I'd like to engage Milu with. What is the actual implementation and onboarding? What's the time frame look like? Does it have to be on renewal? Kind of answer some of those questions.
Yeah, it's honestly really quick and pretty painless. We can go live with a group in a few different ways. Number one is you can introduce us as a standard benefit. HR announces us, and of course we sign contracts and all that, but HR announces us, we roll out. We just need an enrollment file to get started. Like, we don't need to go and set up claims feeds and deep integrations, and we don't need to rip anything out. You don't need to change the plan. Like, nothing needs to change, which is amazing. Because what powers us is not data that has to come from carriers, and so it becomes really easy. The other thing that we found that's really helpful is employees can actually sign up for us during open enrollment. As they're going through open enrollment, we can tell, hey, you've elected medical. By the way, we have this thing called Milu. Here's what it is. Here's what we're asking you to sign up for and consent to. Are you okay with that? And they can say yes. And when folks do that, we see, dramatically higher utilization rates, because you're not buried in their inbox. You're right in front of them. They have to still, explicitly say yes, right?
Yes.
It's not like claims data, but, it's here's what it is. Yes, no. And so to do that, obviously it's got to be open enrollment, but to get started, we can go out anytime. Oftentimes, we're going out mid-year with a group. They're introducing us, so it's not caught in like the confusion of.
Yeah, I actually see that might actually be better, is doing it off cycle so that it isn't lost in the shuffle of everything else they might be doing at that point. And it's like, hey, let's have a dedicated time to discuss what Milu does, and here's the value to as a member. Because I think most employers, one, they most of them operate in a paternalistic way, which is we want to provide great health insurance or healthcare solutions to our employees, but we also want to save money, right? And so sometimes those things seem like they're at odds. The reality is, I believe that's a strong misconception that those things are at odds, but most employers feel that that's the case. And so doing something like this off cycle to say, hey, we built a plan. Now off cycle, let's talk about what Milu actually could do for us over the long haul. Let's focus on it. Here's the value to you as an individual. But if we have enough people adopt it and use it and get value, guess what's going to happen over time? Costs are going to go down. And we're probably going to have a better experience around this healthcare system that we have in the United States, where members feel like, I'm actually getting really good benefits from my employer. This is awesome. I want to stay, or I want to sign up and work for this company because the benefits are so great.
Yeah.
And I think that's not, it's not that hard to actually achieve with just a little bit of effort and a willingness to lean in. A good consultant obviously is very valuable in this equation as well. But every employer, for the most part, has the ability to do the things that we're discussing right
100%. And the mid-year point is awesome, because what we see is groups go and they'll roll us out during a year. And then when it comes time for open enrollment, people know about us, they've heard about us, they can put us into open enrollment, and then that really skyrockets utilization. You go from, I've had 30% of people sign up to I've got 80% of people sign up. And that makes all the difference. But we've started going. Everyone knows, generally they've heard the name.
I'm sure there's some water cooler talk that's happened eventually, like, oh man, I had this great experience. The Milu really helped me with this. You should sign up. Why didn't you sign up? You get a little peer pressure probably as well.
Having spent years working alongside healthcare leaders, brokers, and employers, I know how overwhelming healthcare can feel for our customers. We've all been there. Those renewal conversations that never seem to get easier. Rising pharmacy costs and medical costs, and no real transparency into where healthcare dollars are going. That's why I'm excited about Milu Health. They're not just fixing the old system. They've rebuilt self-funded benefits from the ground up. With Milu's network, you can offer something truly different. No copays, no deductibles, zero out-of-pocket costs when members see a provider. It's the kind of benefit that makes everyone ask, Why hasn't healthcare always worked this way? Ready to bring your clients something different? Visit KnowMeHealth.com and see how KnowMe is rebuilding healthcare, one employer and one community at a time.
We're in that with one group right now. Like one of the advisors who we work really closely with came to us and said, "Listen, we have a group. We just brought in an amazing solution for them. It's one of these solutions where folks have a whole network of doctors they can go to, and it costs $0 if they go there, or they could use their standard PPO card. But nobody knows about it. We don't know how to roll it out. When we roll it out, like 2% of people are going to use it. It's going to confuse them. So what we want to do is bring in Milu, both these things midway through the year, and use Milu to go and drive proactive adoption of this other solution that is going to get people to great doctors at zero cost. And we're going to go do it right now, middle of summer, and then they're going to get to open enrollment next year. They're going to have had an experience with it, and we'll get more people to sign up.
Yeah.
Great.
That's awesome.
Easy.
Do you have enough longitudinal data yet to really kind of quantify perhaps claim saving impact? I mean, not on an individual disease state, but like broadly across a plan. What are you seeing materialize?
Yeah, it's interesting. We need more data to feel really, really confident.
Yeah.
What I know is this: generally, we see like a 3x, 4x, even 5x ROI on our own cost. Okay. And the other piece is, we're never, because a lot of the things that we do are going to be soft savings. We recommend a high quality doctor. We catch something that's starting to happen. I can't promise you that surgery was going to happen otherwise, but I can promise you that we got someone into PT who was talking about seeing a spine specialist, right? And the way we think about it is, if you want like 30% savings on your cost, you're going to go and work with your advisor and kind of think of some solutions that are going to totally change your plan, right? You're going to do RBP or something else to get like really, really high savings like that. And then you're going to find some place in that spectrum where you want to land. I want this kind of network and I want these solutions, and like, here are the cost savings I want to get to. You should make those decisions separate from a Milu, because they're ultimately going to be the most either disruptive or not, and the most savings or not. Once you've made those decisions, then you can optimize it. And that's where we come in. And so, I don't know, I think those savings are always going to be in the single digits, but they're going to be very real, and they're going to sit on top of whatever else you've already done.
Right. I think I see what you're saying, right? It's almost icing on the cake of a plan.
Exactly.
And since you mentioned RBP, I am curious if you dovetail very nicely with reference-based pricing vendors and help them be better at their jobs as well.
We're just starting to, but I think it's huge, right?
Well, because I was thinking in my head, and I'll give you a chance to kind of think about it as well, but oftentimes they don't always have agreed upon terms with the facility. And so they may have to go and out in front of the member who's pre-cert and is going to go here and say, hey, we've got a member that's coming to you in 2 weeks or scheduled for this procedure. Here's what we can pay. Do you accept or not? And the negotiations start. If you could help them even earlier on in the spectrum identify the progression and where somebody's likely to end up, they can go ahead and have that conversation in advance where it's not as urgent and find common ground with the facility and get to a good price. I think that could help them be better at what they do.
Exactly. And on the member side too, right? Like, we could see that someone's starting to go down the path towards a surgery, an infusion, et cetera. And so we can reach out to them, or their navigator or the RBP vendor can reach out to them and say, listen, just so you know, as you go down this path, like, if you go to this place, you're going to get to the door and it's going to be an uncomfortable experience. If you go to this place, we're already contracted with them and it's going to be super easy. And so by seeing that and seeing that someone's starting to go to a place that is not going to be RBP friendly, you can at least go and have that conversation with the member ahead of time.
Yeah. Yeah. Well, so long-term goals for you as we kind of inch towards the end here. Long-term goals with Milu. What's the vision that you've cast for it?
It's funny. We think about this a lot. This is a little bit pie in the sky, but I want us to be a provider organization that sits there for millions of patients and identifies the thing that is coming in the future that can help them. And, that can be there's this medication that you're going to get, or that has this conflict. It could be there's this care gap. It could be there's this surgery happening. But it's the crystal ball that sits there and connects you to a provider on our team, or a provider who's your DPC, direct primary care, or a specialist. But it's a thing that doesn't let you get lost in the shuffle of the healthcare system. That can save you money, et cetera. But it's you saying, hey, I want to have this relationship with a group of providers and with technology that can go and help me ahead of time, and it does it. And all you have to do is say yes, and you get a text message when there's something that's relevant. We don't bother you in your life when there isn't.
I love that, man. The text message component, I think, is really huge. And it seems so obvious, right? But people are so tired of downloading new apps or having to go into different portals to get information. Just a simple text message, outreach, connection with a human being, tell me what I need to know. I can communicate right there. I've already got iMessage on my phone. So why would I need to go download?
I don't want to log into another thing.
I don't want to log in and remember a password, right? I mean, it's just keep it very simple. I think we've overcomplicated certain solution sets in this space. And I think just remembering what's simple and what actually works, text messages work.
100%.
We focus mostly on private sector. Is there an application in the world of like Medicare where you guys could eventually be embedded and assist with the public sector
I think so.
as well? Okay.
I definitely think so. We haven't done it yet. Medicare, Medicaid, like there's a ton of opportunities to help those folks in a very real way. The technology is all the same. It's just the use case is a little different. The patient population is a little bit different.
Sure.
But at the end of the day, it's data, it's providers, and it's patient communication. Like those are the three things that we're building with our employer groups today.
Cool, man. Well, Sasha, anything we didn't cover? Because I know we didn't have our normal prep session, and I'm glad we got a kind of crash course prep session beforehand. But did we miss anything that's crucial for the audience to understand about your business?
No, I think we hit it.
Okay. Well, you get the opportunity then. Why don't you leave us with some closing thoughts for the folks that listen to the full episode? What do you want them to think about or remind them of as they go about their day?
I think there's two things. One is I think anyone that's watching and listening to this is actively trying to do something different and better in our healthcare system. And you just got to keep going and doing it because patients need you and the system needs you and employers need you. So like whatever it is, even if it has nothing whatsoever to do with us, just please keep doing it because it's painful and it needs to happen. Otherwise, like I don't know where our country goes because no one can afford healthcare. I think that's number one. Number two is I do think there's a future and a solution out there where technology on top of data can save lives for patients and dramatically reduce costs. Whether we do that, whether other folks do that, I don't know. But there needs to be a whole new suite of solutions that are forward-looking and proactive and real-time, and we got to go and build that.
Okay. Well, last question, since we didn't cover it. The name Milu, what does it mean? I know we were joking ahead of time, but I'd give you a chance to tell us a story around that.
Yeah, so a Milu is an approximation of the number pi, 3.1415, It's out there. Everyone's heard of it. No one really has any idea like what to do with it, how to deal with it. It's kind of like healthcare. A Milu approximates pi. It simplifies pi. So we think about Milu trying to simplify the U.S. healthcare system just a little bit at a time.
Awesome. Perfect way to end it. Well, thanks, Sasha. Again,
Thanks,
I really
Spencer.
appreciate you, man.